this extraordinary time. I'm very delighted this morning to be able to welcome and appreciative of the time of our town leadership in Needham, who are going to be able to provide us an update on what's happening in town in regards to every question that you may have. We'll be able to take your questions at the end. Would like to begin this morning by introducing John Bulian, the chair of the select board, for some opening comments, and then we'll introduce everyone else as we go through the morning. So, Chairman Bulian, thank you very much for your time and your leadership, and love to hear what you're thinking this morning and what you see.
Thanks, Greg, and thank you all for attending. And I think Zoom has become an important part of our lives. It fills time. It allows us to stay connected with with everybody. And it's just, I think it's all of us getting used to this type of meeting format, and we're all experiencing the same type of elements with respect to what's going on in our lives. I want to thank Greg and the Chamber for hosting this and for the other programs that you're putting on. I do get the emails from the Chamber. I will be attending and participating in other forums ongoing, and look forward to the information that the Chamber is bringing forward to the business community and the community as a whole. I want to thank the businesses for their patience and creativity in this situation. I'm a small business owner. My revenues have dropped to zero. The joy of being self-employed is wonderful. I've enjoyed it for the 30 years I've been self-employed, and I'm still going to enjoy it in the future. And I'm also at a point in my life and career where, okay, I'm prepared. I'm planned. I know it's not as easy for some other retail businesses. I am frontline retail. I am in people's homes. People don't want me in their homes. I don't want to be in their homes. So I understand as well, if not better than most, what the small businesses are going through. I want to thank the residents for adhering to the social distancing. I think what we're starting to see is the early stages of what's known as flattening the curve, and that doesn't mean this is over. And I think that we probably all know that we're far from that, but we need to give our healthcare professionals and our healthcare facilities the ability to handle and treat the people that are most affected in order to give them the best chance of survival. And ultimately we will get back to business. We're here today. We want to listen to the business community. We want to understand how we can support them, and we want to understand and ask how we can help. We don't have all of the answers to all of your questions, but I think all of us collectively working together and listening and sharing experiences can better help all of us going forward. This is new ground for all of us, and it's quite frankly a little scary. But and all I can say is, stay safe to everybody. And I'm going to turn it back to Greg. Thank you so much for including me.
Great. Well, thank you very much. And next up, we'd like to hear from Kate Fitzpatrick, Town Manager. Kate, you can give us an update on what's happening and what you're seeing from the town's perspective. And you're on mute, Kate.
Okay, thank you, Greg. I'll get the hang of this eventually. Or maybe we'll be over and I won't get the hang of it. So I would just like to echo what Chairman Bulian said, which is it is a scary time for a lot of people, and me and everyone else I come in contact with, because things keep changing every day. And just wanted to give a shout out to the employees of the town who are working on the front lines in public works, public health, public safety. They're really facing unknowns every day. And also the other folks in Needham who are on the front lines, including our healthcare workers, and really the unsung heroes, our grocery workers, right? They're just out there doing an amazing job. And by grocery, I mean all of the stores that are essential and are open. Needham is fortunate that we actually have a very robust emergency management planning structure. In fact, we have, for a community of our size, a very strong program, and we have a full-time emergency management administrator, which is fairly unusual and which has frankly been invaluable in this time. We do a lot of training. In fact, in both January and February, our senior managers all over town were involved in incident command training. So it was very much top of mind for us. So our team implemented our incident command, and we set up an emergency operations center at the Rosemary complex, where we have a team of 4 who essentially work there all day, every day, responding to this community crisis, a national and worldwide crisis. So the EOC is in operation. The key team members who are not in the EOC but are working, we actually have a call every single day to catch up and fill in the planning and the logistics and the operations and understand what's happening in the community. The select board has been meeting weekly to get updates and help get the word out from the EOC and our health professionals and public safety professionals, and that's been very well received in the community. We're running our select board meetings on Zoom now, so now we know who's there and who's watching, and they're also, thanks to our very good partners over at Needham channel, that Zoom meetings are being broadcast on cable so that the public can see them, and they're now actually being streamed on cable on the Needham channel website, so that's been really helpful. We also have a number of essential services that are up and running. As you would imagine, the water and sewer operations can't come to a halt. We have the staff doing those. And in Needham, in particular, I think, because we have a drop-off facility for trash and recycling for household waste, you know, in communities where there's curbside, it maybe isn't quite as difficult because you have a lot of people congregating at the RTS to drop off their trash. So we have folks working up there every day, and we've implemented new measures to keep them and the public safe. So we're providing that. Other services that we're providing in some of our departments like recreation, aging, youth and family services, library and health are reaching out to the general public and also some of the most vulnerable members of our public, the young people and seniors. And our senior center folks are doing a fabulous job in making sure everybody has something to eat if they need it, and gets a reach out from our staff, our social workers every day. I did want to mention, Greg, that we have what I think is incredible communication tools that are available to residents and businesses to find out about what's going on in town. The team does an update every day, the EOC team, from Monday through Friday, and it's available. We have a separate web page called needhamma.gov/coronavirus, and there's a lot of really interesting information. All of those daily updates are posted there every day, and our residents and businesses can also sign up for our Alert Needham so that they could get notification of things that are happening in Needham. And that's actually gotten so easy. You can text Needham, the word Needham, to 67283, and you'll be automatically signed up for our Alert Needham system. And it's just been really helpful. It's grown exponentially. I'm sure Cyndi can talk about that information.
Great. Thank you very much, Kate. And I want to mention right now to tell folks that we will be able to take questions. And if you've not done that before, if you go, typically it's going to be on the bottom of your screen. You'll see a Q&A box where you can submit questions. If you're watching on an iPad or an iPhone or some other device, it might be up top, but look for that Q&A function and you'll be able to submit questions, which we'll be asking in a few minutes. But first I wanted to call next on Tim McDonald, who is the Health and Human Services Director for the town. Tim, we had you on a webinar. It was probably 3 weeks ago, but it feels like 4 years ago, just as we were starting to gear up for this. And we got an update from you then, along with folks in Newton. But we appreciate all you've been doing between now and then, and we'd love to hear what you're seeing right now.
Sure, and I'll try to keep it brief. So Needham is, like many communities, working to actively promote public education and messages about the importance of social distancing and about the steps that people and businesses can take to keep themselves and their loved ones safe. A lot of the focus within the public health division is on working with our food service establishments. A number of food service establishments in Needham have continued their operations if they were primarily takeout or delivery based, and a number that were primarily in restaurant dining have switched to takeout and delivery. A number of residents have had questions about this, and a number of businesses have reached out. We've pushed out guidance and we've spoken to businesses. We have a lot of responsible operators here in Needham that take food service and food safety very seriously. And we've worked closely with them and we're very happy. Inspections of restaurants do continue, obviously. because that is a way, if not done carefully, that people can get sick. But we've been fortunate to have businesses that are very attentive to detail and have asked clarifying questions, have admitted when they need more information or things like that, and we're quite lucky. We have also worked with businesses who've had questions about the essential services. The information from the state is in some cases a little bit confusing, and sometimes there's clarification required, and there is an option to do that through the state website. But in general, we've been working with any business that contacts us and trying to help them go through the information that's on the state website to determine if they are an essential operation, and if so, how they can continue their services in a way that meets the guidelines that the state has put out about minimizing human contact and reducing in-person operations or brick and mortar operations. I certainly can give more updates. One of the things that we've been gratified by is the number of residents that have volunteered for Needham's Medical Reserve Corps. That's certainly a very nice thing that people are doing, and we really appreciate it. We've also started helping to coordinate PPE donations for, we've taken PPE donations for healthcare and public safety providers, and now we're sort of working with other sort of frontline workers for non-medical grade personal protective equipment, the new CDC guidance about cloth face masks or face coverings. Those are the brief updates, but I'm happy to stay on and looking forward to questions.
Great, thank you. And what has the interaction been, and maybe this is both for Tim and for Kate, about between the town and the hospital, which is obviously such an important part of the healthcare picture, but also such an economic engine for us at the same time?
Okay, I'll start.
Okay.
So I have a weekly call with our partner in the hospital, and we get updates from them about what they're doing, what we're doing, and we have worked with them in the event that the hospital is going to need to set up a large-scale screening site, that we have the area and the staff to help in the traffic and parking and things like that. Those were plans that we had put into place, but they haven't yet been needed or enacted by the hospital, but we are in close communication with them on a weekly basis.
Great, thank you.
I would also add that on an operational level, so Kate talks about a lot of sort of the strategic challenges facing the town and the hospital. On an operational level, we're in touch with infection control at the hospital multiple times per day. We're also in touch, our public health nurses are in touch with all of the long-term care facilities in Needham every weekday, sometimes multiple times a weekday, because we obviously know that long-term care facilities, which have a population that is almost entirely high-risk individuals in the high-risk category, are very important to make sure that they're taking all the steps to keep their residents safe.
Great, thank you. Next up, I'd like to welcome in Cyndi Roy Gonzalez, who is the Public Information Officer for the town. And you've been in this job now 4 or 5 months, right?
Yeah.
Trial by fire.
The timing was either really good or really bad. I'm not sure.
Great. So, and thank you for what you're doing in terms of making sure everyone is up to date on things. But you can tell us a little about what you're seeing and what you're doing.
Sure. Well, thank you for having us. And as Kate mentioned, there are lots of different platforms that we're trying to use right now to disseminate information to the public. Social media is obviously a huge component of that. So the town is on Facebook and Twitter as the Town of Needham. We're also on Instagram as the Town of Needham MA, and that's fun. You get to see some of our videos and photos of our community dog, Rocket. So Rocket has some good messages on the Instagram. But we also started to create some COVID-specific platforms. So as Kate mentioned, we created a COVID email list where you can receive a daily update directly in your inbox. So if you go to needhamma.gov/coronavirus, right at the top, you can click a link, sign up, and Monday through Friday, you'll get an email. So that's been super successful. We have about 900 people signed up on that email list, in addition to our regular email list, our town website, the new coronavirus website. So pretty much anything and everything you want to know about how the town of Needham and the schools are dealing with this crisis, you can find on one of those platforms. And I just want to thank people for engaging and giving us their feedback about how we can improve it and how we can make the information more valuable to people. I think you're muted, Greg.
Yes, I am. Finally, I wanted to turn it, none of these things that happen, no functions in government or business happen in a vacuum. And obviously what the town is doing has got to be coordinated with what's happening on the state level and beyond. And a great partner for the chamber has been a woman named Margaret Laforest, who is with the Mass Office of Business and Economic Development. And Margaret's participated in a lot of our chamber calls and webinars and has been really helpful to us in helping understand a lot of the loans and various programs that are available. So we asked Margaret to join us this morning to be there, tell us a little bit about what's happening on the state level, and also be available once we get into the Q&A question part in just a minute. So Margaret, welcome. You're on mute, but we'll be glad to have you here. There you go.
Thanks. Thank you, Greg. So I have to say, Greg, you and your team, Catherine, have been tremendous partners, and the information you send out that, you know, a lot of you and I have been in communication pretty regularly throughout this, and you're just so timely in packaging it and really doing a great service and value to the Needham community. So I'm really grateful for your partnership. It's a really trying time for all of us, and I just want the community of Needham to know that you're not alone in this, that the Commonwealth is here as your partner, and I welcome the administration, who I'm meeting some of you for the first time on the Zoom call, to know I'm here, and I'll provide my contact information to everyone on this call if I can be of assistance. The Mass Office of Business Development is the executive branch of the Baker-Polito administration under Secretary of Housing and Economic Development Mike Keneally. And normally, our primary role is the state tax credit program, and in partnership with the municipal tax increment financing and the economic development incentive program. We are also like a broker for the Commonwealth to connect businesses with all of the programs and resources that the Commonwealth offers. So as simple as, you might have heard of the Mass Save program, where you're getting insulation and light bulbs in your home. There's a program for residents. When you pay into unemployment, you're paying into the workforce training funds, and as training dollars you can draw down as grants for your staff, to bigger projects like for the Across Your Border in the Northland development that just passed. The Commonwealth put together a MassWorks infrastructure grant to support the economic development of that project. So a real variety. I think what's important to know in this time, I am here as a sounding board for you, or if you have a question that you're having trouble getting answered. I may have heard it already because I'm on calls daily with the SBA, or I can expedite it through some internal contacts for you. What I think is important to know for state information at this point is the governor is doing daily press updates, and I can put some links in the chat window. Today's update is going to be at 3:30, and you're tuned in. It's showed online, it's showed on TV. There's also a text opportunity, and I can send that information. And they're really pushing timely information in the governor's announcements across the various secretariats. And I'll send that out. I know, Tim, you talked about the essential services and any confusion. Our team was involved in helping facilitate over 7,000 requests for essential business clarification. So if there's a business that you're working with, feel free to send them my way as well, or you're welcome to contact me. And then, like I mentioned, the SBA programs, I know that there's a lot of anxiety out there, particularly by those who are self-employed. Those SBA loans are going to be available starting this Friday the 10th, which is a week behind the initial launch. And then also the guidance we're waiting for from the Office of Labor and Workforce Development, Secretary Acosta, particularly around the federal guidance of self-employed 1099 contractors who do not pay into unemployment insurance typically are not eligible for unemployment. Because of the federal legislation, they are now going to be eligible. And the message from the Commonwealth at this time is we have not received the federal guidance on our level to jive with our system. And so we're unable to process those at this time. So we ask for your patience. We'll be providing that information. Secretary Acosta and her team are doing virtual town halls. When this crisis happened, we had 2%, 3% very low unemployment. and a very small team at the Office of Labor and Workforce Development on the unemployment insurance. So they are gearing up their staff. They'll be opening their call center, but in the interim, we do welcome you to tune into these daily virtual town halls, and they each have a Q&A at the end as well. So I'm here for any of the questions today that I can need assistance. And again, I will provide my contact information just so that you're able to make a phone call, get an answer at the end of the phone, and or the email. So if there's anything I can do for any of the businesses in the Needham community, I welcome you to contact me directly.
Thank you, Margaret. I know yesterday the governor announced some new restrictions on grocery stores, bringing down the number of people who can be inside and number of workers to 40%, I believe. And Tim, I think it sounds a little bit like what Trader Joe's had already been doing by limiting the number of people going in there, but maybe a little different for Sudbury and Roach Brothers. I wonder if you can give us a perspective on what this might mean to the grocery stores and how they're operating.
Yes, I think it's going to mean some small changes to Sudbury and Roaches. I do think the guidance is helpful. I will say, having gone into the stores, I think they have done a good job trying to maintain social distance with staff and customers, especially in the queue to pay. But having this guidance is certainly helpful from the state government. So we're going to make sure that Roaches and Sudbury have seen it. We were actually in touch with them yesterday about some tweaks to their sort of infection control and spacing practices. So we'll be in touch again.
And I guess the same thing applies for other stores that are open, even if it's not covered by the order. So like the pharmacies and everything in terms of spacing. Are you working with those stores, or someone working with them to make sure they're doing what you think is right?
Yeah, our environmental health agents are contacting all of our businesses, especially food service establishments, but they're also going to the pharmacies to go over the state guidance. If there are additional questions, we certainly welcome them, but it's helpful when the state gives guidance. The rest of the time, we just use our best judgment based on what the state has given us, and we have responsible business owners who are very responsive, and they're they take consideration for their staff and their patrons seriously.
Great, thank you. And one more question we just got. You mentioned the Medical Reserve Corps. Can you explain a little bit what that does, and are you still looking for volunteers, and what's the application process?
Sure. So the Medical Reserve Corps are both medical and non-medical, because we need people to help with administrative and logistical functions that would support the health department or other operations that have a health or medical focus within the community. So one sort of obvious example might be if there had been a major power outage, we might have to open a community shelter. In this instance, it's certainly a while off, unfortunately, but if or when there's an antiviral medication developed, or if there is a vaccine developed, doing either emergency dispensing or vaccination on a large scale would require resources that are beyond the public health department. What we do is it's a fairly simple application. If there is a clinical licensure, we verify clinical licensure. So we work with the state boards of registration in nursing or pharmacy or what have you for the particular medical profession. We also do a national criminal and sex offender check for all of our volunteers to make sure that they are safe to work with the public. But it's a fairly simple process. I know that Newton also has a very active Medical Reserve Corps, and it's a way that people can help out their community. In some instances, and it's fairly limited, we do deploy outside of Needham if there isn't a need in Needham, but there is a need from a surrounding community. We want to continue to try to be a good neighbor, and in some cases we have used our Medical Reserve Corps for those actions as well.
Great, thank you. A question, I guess we're going to get a lot of them for you, Tim, I think this morning. So the question about testing and how someone who feels they want to get tested can do that. And in particular, Bruce is asking, they sound like they're drive-in setups. What does someone do if there's no driver in the household? How would they access it?
Sure, I think it's a very good question. The first step for anyone is to call their primary care physician, to call their doctor. There are still, I think people might be tired of hearing it, but unfortunately it's still the case. There are still fairly significant restrictions on testing. It's not the case that if you feel like you need a test, you can have one. You have to have specific symptoms. You have to review them with your physician, who can then order a test. Bruce's question, specifically the logistics of it, we'd be happy to try to help. A number of clinics are drive up. A number of clinics are going to a healthcare facility to be tested. But certainly if someone is homebound or doesn't have easy access to transportation, that's something the town would be happy to try to help them navigate. But the first step is always to contact their primary care physician, because that doctor, she or he, is in the best position to understand their patient's healthcare needs and their symptoms that they describe to the doctor and decide whether that is appropriate and meets the state's clinical guidelines for testing at this point.
Greg, could I chime in a moment?
Yeah.
The Commonwealth has implemented a partnership with Buoy for some telehealth, and I just put a text into the link on that. So that is a way that the Commonwealth is putting a partnership together to really help direct people with where they can go if they're experiencing symptoms and next steps for them. So there's some online questions that they then would direct you to what the appropriate resource, response resource would be for you. So in addition to your healthcare, if it's after hours or something, please take a look at that. And I just put that link in the chat, and I'll put the other links I referenced in there.
Terrific, thank you. And Margaret, I think we're going to send this one to you too. So how do we address the issue that our bank does not have the PP loan available to us? Maybe you could start there, and I can add something to that too.
Sure. So one, I would say, hey, we're the Chamber of Commerce. Are there any chamber member business banks memberships that are stepping up to assist that locally? We have heard some mixed communications on various banks. It seems to me that the larger banks, the Bank of America's, the Citizens, are this is our policy. And what we're hearing is a lot of local banks that are, responsive to their customer needs. So I would spend some time on the phone, and I would probably start with a chamber member bank if you're local in Needham to say, here's what I'm experiencing, this is what I'm looking to apply for. The other thing is a lot of the banks haven't judged that their own PPP application, because the PPP program you apply direct through the bank. You can go to the Treasury website, and if I can put that link, I'm writing myself a note here, to that application. So the encouragement is complete the application so you know the information they're going to ask for. If the bank's doing their own application, then you've got your homework started. So that's some guidance that we've been saying, but we're hearing the feedback with the difficulty of accessing. There are SBA 7A preferred lenders that are typical SBA lenders. There's a bank match tool on the SBA website to match you with a lender as well. But we are hearing from banks that they're prioritizing, these are our customers, this is who we have a banking relationship. But it's disappointing because a lot of businesses who have strong banking relationships, what they're hearing, I think this was the Bank of America had said, that unless you had a loan with us or a credit card with us, we're not going to prioritize you in our queue, even though you're an existing business customer. So we've been hearing frustration from our businesses relative to this with the PPP. So my hope is you have a chamber member bank willing to step up and help some of your other chamber members.
Well, and in fact, we do, and we list all our member banks on our website. And yesterday I did receive an email from Joe Campanelli, who's the president of Needham Bank, who we all know is very active in the community in so many ways. And he said they will work with anybody who needs it, who's in the community. So a Needham Bank would be one of your options. And I think there's probably some other banks in town that can be part of that too. We want to remind you that we've got opportunity for questions. You can hit the Q&A button at the bottom there, or wherever it is on your screen, and type in your questions. I'm not sure this is a question anyone can answer, but we're going to try it. We are a 25-year-old nonprofit in Needham, the Ellie Fund. We support breast cancer patients while they are in treatment. Last month, we delivered meals and gave out almost $50,000 in groceries and gift cards to patients in the Commonwealth. How do we apply for the new fund set up by Lauren Baker? We are not part of the United Way or connected to Community Foundation. I don't know if you know, Margaret, about that and how that fund is going to operate.
Oh, okay, sorry.
Yeah.
I thought I was muted. So I can put the link in too to get you connected with the community fund. They've already raised $13 million. It's terrific. So I'll send that and happy to make any connections as well.
Yeah. Chairman Bulian, maybe you could just reflect in general on the kinds of responses you're seeing around the community and what you're seeing in terms of people stepping up. It's been pretty remarkable. I think you'll agree.
I will tell you, people have stepped up, and I think that the better response by the population has been most people that I know are staying home, and which is really what the emphasis from government at all levels has been. but yes, people are stepping up. People are, people are looking to, to get involved, to help neighbors. And I think that's pretty much it from neighborhood to neighborhood. We have a small neighborhood, about 100 houses in my neighborhood, and people reach out. I have an elderly gentleman across the street. We check up on him. We talk from afar, and he is still a spry. He's a spry 98. And so, it's just been neighbor helping neighbor. People are there for each other. I think one of the biggest things is, where do you get toilet paper? Okay, just, that's the thing. That's one of the stories that will be written when this is all said and done is, and it's just, I just don't understand. I don't understand it personally. People, the shopping. I know, Tim, that we've talked, and you've been, before our meetings, we want people to go with a list. I know that this week and next week are indicated to be very difficult. We reach out to people that we know to say, hey, can we pick up anything for you? They do likewise. We all look to reduce the number of trips that we make. We go in prepared, get in and out. I don't know how this new order by the governor is going to change the queuing outside of supermarkets. I think it's going to lengthen the experience. I know that people will still be separated by the 6-foot distancing, but I think that everybody has to work together. This is, I give a shout out to our first responders. They're the people that are called in for all types of issues. A 911 call or a call to police and fire, they never know what they're going into. Luckily the number of calls have been down. I know that right now we've been able to maintain an adequate supply of PPE for them. I also know many people that are part of the hospital network in this city, including Needham, and what they're going through, I can't even imagine, day in and day out, and what they're seeing. We all sit at home watching our TV and watching the reports. There are people that are here in Needham, in Newton, that are on the front lines. I think that, we're all hearing things. We even know, I know, and I'm sure all of us know people that have had the virus. Hearing the stories, talking with people who have it and who have gone through it. It's just, there's just a scariness out there. We all want to get through this. We don't know when it's going to end. We don't know how we're going to come back. I think my wife and I were talking just the other day with some friends on the phone, and how do we go to a restaurant? When do we go to a restaurant? My wife plays mahjong with her friends. When do they go back to playing mahjong? When do we start normalizing our lives? And is that, how many months is that? Is that in 6 months, 9 months? I don't know. So this is such new ground, new experience. So many unknowns. We just have to get people through the time that we're in. The only good thing, if there is a good, is that the weather is on our side. The weather is improving week to week, and which is great. Summer is going to look a little bit different around here than it's ever looked. Do we still go to packed beaches during the summer? I don't know. I don't know yet. So.
Yeah, Tim, the question there, John had mentioned the idea of this being peak time. We know we've heard the projections in the next 2 weeks. It really could be maybe the top of the curve. If someone's thinking about that they need to go do that errand, go to a grocery store, go to Harvey's or wherever, they don't need it right now, but they know they need it this month because, they know that everything's going to be closed down for at least the next month. Is it better to wait a couple of weeks? Does it matter whether you go tomorrow or you wait 10 days on it?
I think more than the timing specifically is that you, and John referenced this, but you go with a specific plan and you take steps to minimize your exposure while in store. So the CDC came out late Friday afternoon with guidance about wearing cloth face coverings. We're obviously talked repeatedly about washing your hands, not touching your hands to your face. Having a cloth face covering is helpful because it feels different and you aren't as likely to touch your hands to your face. But I think the better than say, going either this Tuesday versus next Tuesday is taking time in advance to think about how you're going to minimize your exposure. what time you're going to go, what you're specifically getting, if you can remember where they are roughly in the store so you aren't going up and down the aisles, and those steps to take. I have taken to wearing light cotton gloves, like light winter gloves. I generally bring those with me to the store. I try to be careful about infection control, but I think it's a good practice to wear gloves in the store, even though the stores have been very good about sanitizing carts and carriages and everything. I still think it's probably a good idea for people to do that. Certainly if someone can wait, that's fine, but I would counsel thinking carefully about the steps you're going to take to minimize your exposure while in the store, because there are some things that can't be postponed for a week. Some people need their medication now. Some people are running low on some of the essentials in their everyday diet. So if you are going to go to the store, just think about it and do it responsibly.
Right. And Kate Fitzpatrick, their question about construction and what's allowed now in terms of construction and what isn't.
So as of this week, the town has stopped issuing new building permits and any demolition permits. We are trying to do everything we can to keep projects that are ongoing moving. So to the extent that we have inspectors available and that they have the proper PPE, and we're doing some online and some creative ways that we can keep those projects moving. But for demolitions, we simply don't have the ability to allocate our fire and building staff for those. And for new permits, we have rolled out a brand new online permitting system. So applicants are able to put in new building permits. They'll get access into the system, and the paperwork, in some cases that can be done remotely from our staffs who are working at home. Some of those are continuing to move along so that when we lift this period, or we're in the next period of this next new normal, some of those will have moved forward. But right now, essential services, including municipal construction, are ongoing, and projects that were already in process and are nearing completion are ongoing.
Great, thanks. So you're starting to think about something you want to do when it's over. There's a way to work with the town to move that ball down the court a little bit.
That's right. If you look on the town's webpage under the building department, you'll find the online permitting system.
Great, thanks. Question, do elder services or community council need drivers? Lots of young adults are home with nothing to do. Is there a safe way to volunteer for that kind of work? Anybody?
We do, the state does have a program. It's aligned with those wanting to donate PPE or sell PPE. They're also a volunteer responder. Some medical professionals who are no longer, maybe retired or have time that they're able to provide, have been connecting, and I'll add that to my links. I owe the COVID-19 Lauren Baker Fund, as well as the, let me look for the PPE, the link, and you can log on to sign up for to support mass response. So I will send that.
Right. And I'm not sure if anybody knows what the community council needs, but I guess they could check with the community council, right? Kate, a follow-up to the question about construction. What about restrictions on landscapers, lawn services? See a lot of them out in the neighborhood. Are they able to function or legally supposed to be there?
It's my understanding, Tim can correct me if I'm wrong, that landscapers are allowed to work under the governor's order. We continue to put out the guidance that we're hoping people are using PPE and that they're practicing social distancing, but that they are allowed.
We have also spoken to a couple of operators who've called to the health department, and the state has pretty clear guidance on it. It is allowed. We've encouraged them to take some steps to keep themselves and their employees safe, like Kate said, with proper person protective equipment and with distancing. I think maybe on a typical day you might see 2 or 3 guys in a cab with a bunch of equipment in the bed of the truck, and now they're taking potentially more vehicles, or they're taking a little bit longer because only one person is driving in each vehicle. But that's just some of the steps they have to take to be able to operate safely.
And Tim, someone is wondering, what's the next threshold for more stringent measures? What would more stringent measures look like?
So I think in Needham, there's a limited amount of things that we can do beyond what has already been done. So the town public health department, town government, and the schools work together to cancel large events and after school activities, and then to actually close the schools. And that was in advance of the state government order. The town took the step a little bit before the state of closing down daycares. We've closed down parks and playgrounds. We've encouraged people to get activities at outdoor recreation areas like trails, but not to congregate on a playground or a basketball court. So the town has taken a lot of steps it can take in terms of limiting or restricting activities. Our big push now is on public education and messaging. There certainly are steps that the governor could take. I think the challenge is, some people want a hard lockdown. And from my perspective, I think there's real challenges with that, because there are a lot of necessities that people need. And when you have a hard lockdown in place like that, it ends up that you have to make exceptions for so many categories of people that it's not particularly effective. I think if people are able to maintain what is right now a fairly challenging level of restrictions and modifications to their daily course of activity, if they can maintain this for a period, that's how we reduce community spread. That's how we really stamp out the infection within the community. So I'm not an expert, but I would tell you that I don't think there's more restrictions. I think continuing this and people continuing to take it seriously. I still unfortunately get quite a few emails and calls on a daily basis about, my neighbor's college-age son isn't taking this seriously. He's having people over. I just saw some kids playing basketball. We do our best to try to remind people about social distancing and its importance. We do our best to encourage it. But we're relying on residents to care about themselves and the community good. And we're relying on them to take the guidance and the recommendations seriously. And the vast majority are.
Very good. Margaret, maybe I will direct this in your direction. There's someone asking are there any programs that help someone who need assistance with their landlords who are not working with us and simply told us to get a loan? Can somebody intervene?
Thank you. You know what? I know that, and I don't know if it's a small one-off landlord or the larger landlords. I know a lot of the communities have done some outreach to the landlords asking for, some flexibility with the timeline for the rent. Particularly in light of the federal guidance, if someone is unemployed, the unemployment insurance coming through, they are going to be getting, that $600 bonus for everybody on unemployment. Some communities have been doing rent relief programs, like in Quincy, it was the Affordable Housing Trust is helping to provide some rent relief. So there's been some creative options, and I don't know that there's been anything blanket. We were on a call last week with Congressman Kennedy, and we were talking about, that is a hot topic, whether it's residential, whether it's commercial, and it's talking about, well, we don't want to be displacing people from their home and creating homelessness. The landlord then has to pay their mortgage. The commercial tenant has to pay their rent, pay their landlord, and how the real estate market up the chain needs help at all levels of support, right? Because if you're, helping if you give the forgiveness in the front end, well, now you've got the landowner and he's in struggle with the business owner. So I would say that's a definite trending topic, and that it's tough, because what is the situation that landlord is in, and what is the situation in the commercial real estate market? There's a lot of anxiety around that right now. So I would say that you may have in Needham, and I'm not as familiar with the town of Needham's program, but a community action that has rental assistance. There's a lot of nonprofits, and they are busy as they've ever been with families who are, seeking help from a food pantry that have never needed to do that. So my thought is, do you have a nonprofit in town that would, under regular circumstances, provide rent relief? And they may also have a special COVID program. For example, the fund, and I still am pulling up that link right now, for First Lady Lauren Baker is putting together, that is to direct funds. Instead of us creating a new fund for the Commonwealth to give support, we're going to partner with the organizations that do this good work day in and day out. So, maybe Kate has some information on what that local nonprofit is that serves the Needham area, and I would direct you to call them for some rental assistance support directly for yourself. And the other thing is that PPP, if you're applying for the PPP loan, if it's commercial and it's for a business, the PPP is payroll, 75% payroll, but they are also going to be doing forgiveness. So depending how you work your formula, you have to be 75% payroll, and the other 25% can be rent, mortgage, utilities. So if that was a business question or a personal question, and I'm also happy to offline talk specifics, but my direct suggestion would be, who is that frontline agency? And then they will be probably receiving funding from the COVID-19 relief fund that is being spearheaded by First Lady Lauren Baker.
Terrific, thank you. Last call for questions from anybody. I've got one more here in the queue. Have you heard of a need for childcare for essential worker residents that's maybe being unmet now? So we know there's some programs for our essential care workers. Do we know of any a need in town that's not being met right now?
The state does have a pretty detailed program set up for childcare workers, childcare for essential workers like healthcare, first responders, people who are working in grocery stores. We have not gotten, and we have gotten a lot of comments, a lot of inquiries, a lot of questions. We have not gotten any comments like that. Certainly, if there are residents or business owners in the community, we're happy to try to help with that. But the state set up a pretty detailed framework to help. There's, I think, more than 400 at last count emergency childcare providers operating throughout the state, and it is a really good resource.
Great, thank you. Any last comments from anybody on the panel that maybe something I forgot or something you could add, remind us about?
I would, Greg, if just to note that at its meeting last week, the select board endorsed our recommendation to implement the legislation that the governor signed at the end of the week, which is to allow people additional time to pay their tax bills, and also to waive certain penalties and interest charges for bills that are paid by the end of the fiscal year. And there's more information on that on our website. So if anybody has any particular questions, to start there, and otherwise they could call our finance department if they need more information.
Right, but essentially it's the delay is until June 1st, which is the latest, last that you're allowed to.
Correct.
Is that correct? Right.
That's correct.
Great, good to know. Anyone else? Cyndi, you want to just remind us about the ways to get in touch with what you have in terms of signups?
Yes, absolutely. So if you go to the Town of Needham's COVID website, it's needhamma.gov/coronavirus. That's where our daily updates are. You can also find our social media on that page. We're on Facebook, Twitter, and Instagram. And you can also use that page to sign up for a daily email or a text message in your inbox.
Great, thank you. And of course, the Chamber will keep you up to date too if you're on our emails. And I'm grateful to each of you for being with us today, and for everybody who's watching in. Really helpful to have your time today. So thank you very much. And a note to everybody who's watching, I think when this ends, there's a survey that will pop up on your screen, and we'd love to have you respond to it if it indeed does pop up. But either way, we thank you and wish everybody well, and thanks again for being part of this.
Thank you.
Thanks, Greg.
Yeah, thank you.